You're listening to the Beyond Measurements and Image podcast, where we build healthier lifestyles, elevate your well-being, and transform lives. Welcome to BMI.
I'm your host, Dr. Drew Crawford. I'm a board-certified gastroenterologist and obesity medicine specialist. Thank you for joining me today on Beyond Measurements and Image. So what is Robert F. Kennedy, Jr., the Secretary of Health and Human Services, doing about the health of the United States? He's got this Make America Healthy Again initiative. Although that sounds really good, it's somewhat vague and it's difficult to discern exactly what he's doing. So today I'm going to just go over a little bit of where he's wanting to go. And more importantly, we'll probably start as where we're at, kind of what he inherited, and then just see if the initiatives that he's talking about make sense. And so I'll just lay it out there. I'll give you some historical context, and I'll describe what I understand to be his goals, and I'll leave it up to you to decide if we're on the right track, either previously or under his guidance, or maybe somewhere in between. So the MAHA report, the Make America Healthy Again report, is a 72-page report that he put out, and that's really aimed at children's health. We'll go over that. I think that warrants its own podcast. But let's talk just a little bit about a letter that Secretary Kennedy wrote to the New York Post in April of 2025. And he outlines just generally the status of the health of the nation, as well as to some extent the department that he's over. He goes on to describe that the USA spends more on healthcare than any other country in the world. And the United States also has the highest rate of chronic disease in the world, despite spending more than any other country. He goes on to report that the health of America ranks last in all developed nations. Unfortunately, he doesn't go into detail to describe what the metrics are that make that determination. But under that, he describes that the budget that he inherited at the Department of Health and Human Services had increased 38% since COVID. Now, of course, it makes sense that it would bump up to some extent during COVID, but it's essentially remained up. And since that time, the employees have increased by 17%. During COVID, it went from $1.2 trillion budget to $1.7 trillion, which essentially makes up 1/3 of the federal budget or 7% of the GDP. When he inherited the department, it had 82,000 employees, and since that time, 10,000 employees were able to opt out, and his goal is to decrease it by another 10,000. I think it's an admirable goal to control costs, but of course we need to make sure that we're following the metrics to make sure that we're getting equal or superior results. And that's one thing that the government does very poorly, right? They spend money really good, but they're not results driven. Under his administration, it'll be interesting to see if by decreasing the amount of money that's spent and the amount of employees that there are, if in fact we can at least maintain the same level of health. And really, ideally, we don't want to just control costs. We also want to improve outcomes. And then he recommended that the CDC get back to its core mission of outbreak response and preparedness. And unfortunately, I think during its most recent test with COVID, I would say that it maybe got a C or a C-. They did a lot of the right things in terms of controlling an outbreak, but the distrust that was harbored with the information and the control of information and the inability for any opposing view to be out there really created a lot of distrust, I think, within the medical community, but just in the community at large in the United States. And that really is a problem. We have to be able to trust the science, right? We may never trust politicians. That's probably a good plan, but we need to be able to trust the science. We need to be able to pick up medical journals and read them and understand that what we're reading is scientific and rooted in truth. Multiple articles were published, and then subsequently revisions were made in later editions of the articles that I think really discredited some of the major journals. We need to get back to where we are there. Now, is Kennedy the guy to do that? I don't know. He does have, I think, some good intentions. I think for his age, I think he's a good representative of what we need. But I got to admit also, he's got some kind of quirky ideas on some things, and he's a bit of a lightning rod. So, sometimes to get things back in line, you have to just really come out full force and strike hard. And maybe he's the guy to do that. He's not without some controversy, and I do recognize that. Let's talk about where we came from. So the food pyramid, right? The famous food pyramid that we've all heard so much about and were taught. And really, to be honest with you, a lot of our programs are still based on this. despite the fact that the food pyramid was retired by the U.S. government in 2011. Even though that's the official government line, the policies that were enacted and basically followed through on the food pyramid remain. So let's talk about that. What is the food pyramid made of? Well, of course, it's a pyramid, and the base of the pyramid makes up the biggest part of your diet. And according to the food pyramid, they recommend 6 to 11 servings of breads, cereals, rice, and pastas. Those are all pure carbohydrates, not even complex carbohydrates. Now, it could be somewhat complex, right? If you had whole wheat bread or you had brown rice or maybe even whole wheat pasta, those could be complex. But as a general rule, that's not what we have in the typical American diet. There's a total of 4 levels. One level up, obviously it's a little bit smaller because it's a pyramid, but they recommended 2 to 4 servings of fruit and 3 to 5 servings of vegetables. And then one level above that, 2 to 3 servings of milk, yogurt, or cheese, and then 2 to 3 servings of meat, poultry, fish, dried beans, eggs, and the nuts group. And then in the very top of the pyramid, they were just recommended sparing use of fats, oils, and sweets. And this is all based on the Ansel Keys study. This is all based on the fact that a low-fat diet is supposed to be superior. And as we've talked in previous podcasts, once that became sort of the doctrine that the U.S. government adhered to and that the American Heart Association endorsed, then the race was on to get fats out of foods, which then made them highly unpalatable. And so then they dumped a lot of sugar into them. And when they did that and they processed these foods and packaged them, then you had less expensive, highly palatable, or very tasty foods that were low in fat, which we were told was healthy, which in fact we know really is not the case at all now. So that's the food pyramid. So where did it come from? Well, it's interesting. The origins of the food pyramid aren't even here in the United States. The origins go back to Sweden. And in 1974, the Swedish government was looking for some guidelines to establish because food prices were getting expensive. And what they wanted guidelines to tell their citizens what they could or should eat that were both healthy and affordable. And this was all due to rising prices in 1974. It's worth noting that there were some street protests in the 1970s in Sweden that ultimately led to these guidelines. So it was maybe intended with some extent to provide some health-related information on diet, but really it looks like the overarching purpose behind this was to make sure that people understood their options in terms of affordability. So let's switch over to the United States about that same time. Richard Nixon was president, and he was very concerned as his reelection was coming up with the effects of inflation. He knew that if inflation was out of control, or even perceived as being out of control, that this would hurt his reelection efforts. Of course, like any president, he did the things he could to help to reduce the effects of inflation. But instead of actually really maybe making changes to reduce inflation, one of the things that his Secretary of Agriculture did was he went out and really promoted policies that would work to manipulate the food supply, and then dietary guidelines were altered in such a fashion that these two things in combination would decrease the impact of inflation. So one of the options they had was to subsidize cheap crops. What I mean by that was they made these very low interest rate loans available to farmers to do two things. One, to produce crops that were inexpensive, corn, soy, things that processed foods could be made of, but also it allowed them to make their farms big. The Secretary of Agriculture really wanted all the farmers to work on a big scale where they were able to produce lots of these products. And then in turn, what would happen was they would produce all of these cheap foods that then would be available to make the CPI look better. Let's talk about that for just a minute. So Matthew Lesak wrote a book called Fiat Food, and I highly recommend that you read it. But he gives the example that if you eat steak all the time, and it's a high-priced whole food, right? But if you eat steak and your grocery basket has steak and whole foods in it, and you have, let's just say, $100 budget for food, well, then you're getting good quality whole foods for $100. Well, then when the market is flooded with these cheap foods that aren't whole foods, but that are processed or ultra-processed foods that have a lot of sugars that are made of these cheap food products that the government is subsidizing, such as corn and soybeans, So then your basket is filled with these foods made of these cheap products, such as corn and soybeans. But along with that, the government is altering the dietary guidelines to tell you that those foods are healthier. In combination, you're getting the message that those foods are healthier, and then, of course, they're cheaper. And the net result is you fill your grocery basket with those types of foods. And the net effect is when you go to check out, they're cheaper, so it does not make it look like the consumer price index has gone up. So the feeling that inflation has gone up has not. But what's happened is, in fact, maybe your grocery bill didn't go up, but the quality of the food that you were getting significantly went down. And so it's not a fair trade. It's not comparing apples to apples. And I would argue that the CPI rarely is comparing apples to apples. But in this case, it's a direct reflection of the food that we take. So in the early 1970s, Sweden's having issues with social unrest due to the unaffordability of food, and they developed this food pyramid, as I described. The U.S. government is having not social unrest around that, but the politicians, or particularly Richard Nixon in this case, is very concerned with inflation. And so the Secretary of Agriculture goes out and promotes the production of low-cost crops, which then lead to processed and ultra-processed foods that are cheaper, and they alter the guidelines. You fill your basket with those foods, CPI looks like it's no different, and you think that you're doing well. That was Nixon's attempt at controlling inflation by controlling the food supply. But then also in 1977, Senator George McGovern outlined his dietary guidelines for the United States. And ultimately, this was, again, based on the Ansel Keys studies and all of the information that came from that, which we now know was erroneous at best, and I would argue was intentionally or deliberately altered, because we know that the 7-country study where the information come from was actually a 22-country study, but 7 countries were picked that supported the hypothesis that he wanted. In brief, George McGovern's dietary guidelines for the United States recommended increased consumption of complex carbohydrates up to about 50% of your dietary intake. He did recommend decreasing refined sugars, which was good, but he also recommended decreasing fat, decreasing saturated fat, and decreasing cholesterol. Now, by decreasing fat and saturated fat, what they're recommending is decreasing oils and animal meats, and of course, replacing that with the consumption of carbohydrates, primarily in the form of breads, cereals, rice, and pasta, all of which, again, is at the base of the food pyramid that was developed around that same time, and again, in conjunction with the concept of decreasing CPI by altering the recommendations of what is and isn't healthy, and then also having the added benefit of what they're saying is healthy is also cheap, which serves 2 purposes for them. So that's the origin of the food pyramid. Now, what was the purpose? Well, when I describe it this way, it sounds somewhat nefarious, like as if they had bad intentions. And I do think that probably the Nixon administration, with their goal of decreasing inflation or trying to control inflation and decreasing the quality of food we take, I do think that was probably nefarious at all levels. But maybe McGovern's concept and maybe even the food pyramid developed in Sweden, maybe it was done with good intentions. McGovern stated that the purpose for developing these food guidelines was because they were seeing an increase in heart attacks, an increase in cancer, as well as an increase in obesity. And so he thought that there needed to be some modifications. So this is what he came up with. Now, McGovern was not a physician. I'm sure there were plenty of physicians available on his committee, but for whatever reason, they didn't go with what we now know to be solid science, but they went with what was available, which again, I think was the Ansel Keys study. How effective did those ultimate recommendations prove to be to decrease the rate of heart attacks, decrease the rate of cancer, and decrease the rate of obesity, which was his stated goals? Well, let's look at that. So, heart attacks. From 1977, which was the time that the McGovern recommendations came out, to 2025, the age-adjusted mortality rates from coronary artery disease, from heart attack secondary to coronary artery disease, so that's obstruction of the vessels of the heart, have in fact decreased. But they do feel that a lot of the decreases in that are due to advances in medical interventions as well as education. Education in the form of when you're having chest pain, you get to the hospital sooner, right? We know that if you have a heart attack, the sooner you can get to the hospital to either get a drug that breaks up the clot that's blocking one of those blood vessels, or they can go in and do a heart cath where they actually go into those blood vessels and either kind of clear it out or put a stent across it, which is kind of like a little straw that sort of opens that vessel up. Because when you have a heart attack, what's happening is you have a little clot. You usually have like a plaque or a narrowing of the vessels. And then eventually it just completely occludes. And when it occludes, it's quite painful. You have chest pain. Pain may radiate to your jaw, your arm. You break out in a sweat. You go to the ER. You either get a drug to kind of help break up the clot that's in there, or they take you to the cath lab and can either kind of root that out or put a stent across it. So those advances in medical technologies have really helped a lot, as well as educating the population that when you're having those symptoms, you call 911. We have been massively educated in this country to call 911 and then go to the hospital. So you can imagine if you have an obstruction of one of those little vessels, all of the heart muscle that's supplied by that vessel, if it doesn't have blood flow to it, eventually dies, and that weakens the heart and could ultimately kill the person. So the quicker you get to the hospital and get therapy for that, the better off you are. So there are multiple reasons that we've had decreased incidences of heart attacks. It's not all related to diet. But what we do know is that globally heart disease is worse now. Now, again, it may be not all due to diet, but a big part of it is, and definitely a lot of it's related to obesity. So what do we know from 1977 to 2025? Well, first of all, by decreasing the incidence of heart attacks, we probably have increased longevity, right? Those people that would have had a heart attack and died are living longer now, but also they're living less healthy. So we know that there's an increase in arrhythmias. Let me just talk briefly about how the heart works. So the heart is essentially like a pump, and it pumps blood throughout the body. The muscle squeezes and it causes the heart to pump. And you have to have good blood supply to those muscles, just like you have to have blood supply to your legs to go running. If you don't have good blood supply to your legs and you take off running, your legs hurt because the muscles aren't getting enough blood. And that's true of your heart as well. So like I just spoke about the clot and the ability to get that open and perfuse those muscles in the event that you're having a heart attack, that's true. But there's also a second part. Think about an old farm pump, right? It pumps just like that. It pumps just the same. But you have to have power to that pump, right? You have to plug it into the wall, or you have to have some sort of electrical power to the pump. And that's true of your heart too. And if that electrical power is disrupted or is altered where it's not working quite right, it's medically what is known as an arrhythmia. The most common arrhythmia, of course, is atrial fibrillation. But there's a whole host of them. Tachycardia, your heart's too fast. Bradycardia, your heart's too slow. There's VTAC and VFib, most often which those are highly likely to be fatal. There's all sorts of them. Doesn't matter that we go into them. But what we know is there's a 450% increase in arrhythmias from 1977 to 2025 here in the United States. In terms of heart failure, right? The pump is still working, but it's just kind of falling behind. Oftentimes patients with heart failure, their pump has a decreased ejection fraction. It's not pumping as good as it should. Your heart should fill with blood, and then about 2/3 of it should be pumped out to the body. But in patients who have heart failure, they just don't have good pumping function, or maybe the pump in the relaxing phase, the heart doesn't relax enough to fill with blood. That is what we call heart failure. And we know that there's about 146% increase in heart failure diagnoses between 1977 and 2025. And lastly, the risk of hypertensive heart disease or heart disease secondary to high blood pressure is increased by 106%. And part of that is going to be due to the salt that was added back into the food. When the fat was taken out, they added sugar and salt and additives. And so the increased salt intake is a part of the increased high blood pressure related heart disease. Now let's look at obesity. So remember, McGovern, he had the goal of decreasing heart attacks, decreasing cancer, and decreasing obesity because these were all on the rise. So when the guidelines came out, that was his goal, was to minimize that or decrease it. So we see how that worked in heart disease. Now let's look at obesity. How's that working for him? Well, between 1977 and 1980, the average incidence of obesity was about 15%. Between the 80s and late 90s or early 2000, that number doubled to about 31%. Between 2000 and 2010, it increased to almost 42%. And in 2020, it has stabilized at about 42%. However, 10% of those have gone on to become severely obese. And in children, we know in 1970, there was about a 5% incidence of obesity. And now in 2025, that number's over 20%. here we can see that the incidence of heart disease and obesity have not improved with the guidelines, either the food pyramid or McGovern's dietary guidelines for the United States. Now, it is interesting to know that the dietary guidelines for the United States are updated every 5 years, but when you look at them, the changes have really not been significant. So in terms of cancer rate, overall, there has been a general decrease. How much of that is related to the diet is difficult to discern. But what we know is there's a lot of things that factor it. We do a lot more screening. We do mammograms, prostate exams, colonoscopies, all of these things which catch precancerous tumors early, and we are able to intervene. Also, the tobacco use in the United States has significantly decreased, which substantially alters the incidence of all cancers truly. Also, we're much more proactive with sunscreen, so the risk of skin cancers is significantly decreased. Combine that with the fact that there's improved treatments, right? We have all these immunotherapies now. We've gotten much more advanced in our chemotherapies and actually new surgical interventions. So there's a lot of things that have factored into these decreasing rate of cancers. The dietary guidelines that were added may have some effect. It's very difficult to discern out which is which. However, what we do know is these dietary guidelines actually have led to significant increases in obesity, as we just described, and the incidence of obesity-related cancers have significantly gone up, and that includes breast cancer, colon cancer, pancreatic cancer, esophageal cancer. There's a host of them. I would say the goals of the McGovern dietary guidelines for the United States did not come to fruition. I would say that heart disease on the whole is no better. It's just different. Obesity clearly is markedly worse. And although cancer rates are decreased, I think it's due to multiple things unrelated to those dietary guidelines. Another interesting thought about the government when we're talking about CPI and the general health outcomes is it is interesting that these changes that were made, although I want to think this is completely an innocent byproduct, but the changes that were made actually increased a significant increase in chronic disease in the form of obesity and diabetes and all the complications associated with that. But by doing that, by increasing the chronic illness, it ultimately becomes quite profitable for what Matthew Leisach refers to as the medical industrial complex, which is basically all of the money that's generated in healthcare. The doctor office visits, the hospital stays, all of the procedures, all the pharmaceutical companies. It makes up a huge part of the GDP of the U.S. And although I don't think that was necessarily an intended goal, or at least I want to think that was not an intended goal, it clearly is a byproduct. So here we stand at the origins of the food pyramid and the basic guidelines that have come about. And like I said, they've been altered. The recommendations of the U.S. dietary guidelines do change every 5 years, and there have been some improvements, but on the whole, we have not seen significant changes. RFK wants to reform the U.S. dietary guidelines. The question is there any harm in that? And I would say there's probably not going to be any harm if we go down the right road. So what is it that he's wanting to do? First thing he's wanting to do is he's wanting to decrease ultra-processed foods. It's known currently that ultra-processed foods make up about 60% of the daily caloric intake for children in the United States. So what is an ultra-processed food? It's a food or drink that is formulated from substances that are extracted from food. So it's not a whole food, right? They take foods and they extract things from them and then basically add sugars and salts, emulsifiers, colorings, and process it, and ultra process it ultimately, and then sell it, right? So that's an ultra processed food. And we know that with that, there's a lot of complications that arise from that. One of them are what's known as obesogens, right? And so those are elements of the processing or chemicals that arrive in there, maybe associated with the preservatives or the changes that are made to make them more palatable, that ultimately alter the way the body stores and uses energy. And so some of the obesity is related to the dietary intakes that we're taking there, right? These obesogens, these chemicals in the ultra-processed foods or maybe in the plastics that we're eating out of, warming our food in a plastic container in the microwave. I don't know that it's fully understood where obesogens come from or even exactly what they are. But it does appear that there's alterations to these chemicals that we take in. They alter the way our brain and body work together to regulate satiety, which is the feeling of fullness, and for us to process and use the energy that we take in. A second suggestion that he's made, and they're working to implement across the country, is to restrict the SNAP program, right, which is a Supplemental Nutrition Assistance Program, which is basically what we used to call food stamps. And what they're recommending is that you decrease the ultra-processed foods that are allowed to be purchased on SNAP, as well as decrease the sugary drinks. And the advantage of that is that then that would ideally, if this were to work well, is that would allow the people on SNAP to buy more whole foods, which then could create a healthier environment for them to live in and maybe promote their health, or at least quit deteriorating it and decrease the risk of obesity for those recipients. We do know that there's a significant issue with food deserts. People that live in areas where there's not a grocery store that they can get to, or maybe they don't have transportation because they're low socioeconomic areas. They don't have transportation to get to the grocery stores. So they oftentimes go to fast food joints that are in the neighborhoods, or they go to convenience stores where all they have is ultra processed foods. And so then those people can purchase those, but then they're not ultimately healthy, right? They're these ultra processed foods with these obesogens. So then those SNAP recipients then sort of become victims of this chronic cycle. They're sort of down. They don't have money to get food. They're given some assistance, but then they're having to buy unhealthy stuff that does not promote their health. It ultimately leads to longevity. And then, of course, if they're socioeconomically deprived, then oftentimes those patients don't have insurance. So then they get less health care, or at least delayed health care. Or when they show up, they don't have the means to get sort of maybe the standard of health care. It's a bad process. So restricting the Supplemental Nutrition Assistance Program, or restricting SNAP to where they can get whole foods, or at least decrease their reliance on ultra-processed foods and SNAP, absolutely sounds like a good idea. The implementation of that is going to be the difficult part. Although you may be able to say you can't buy ultra-processed foods or sugary drinks with SNAP, if they don't have access to get anywhere else, makes it difficult for them. A third thing that he's interested in doing is banning artificial food additives and dyes. And I believe he's already taken some measures to do that. What we do know is some of the dyes that we use in this country are banned in other countries. They're banned not because they don't like the color, but of course because they feel that they're carcinogenic, or definitely at least lead to detrimental health outcomes. A fourth goal that is stated is to change the food lunch requirements for the school lunch programs and prisons, etc. That also would include decreasing ultra-processed foods. One of the things that he's recommended is to return whole milk to the school lunch program. Whole milk is just that. It's milk directly as it comes from the cow. Now, they pasteurize it, and ultimately it ends up with about 3 to 5% fat in it. Since the party line was that fat was bad, the processing of milk consisted of putting it in a centrifuge and spinning it, and you pull all the cream off the top. But when you pull all the cream off the top, then you have skim milk, right? You're skimming all of the cream off the top. The cream is where the fat is. You're skimming that off. And so then you're just getting basically the water or the juice that's left in the milk, but it doesn't have any of the fat. So that's skim milk, and that has about 0 to 0.5% fat in it. So very low, but it's interesting. It also skims off the vitamin A and the vitamin D. So as a general rule, skim milk has to be fortified with vitamin A and D. Although there probably is some just left in there from the cow. They have to fortify it with vitamin A and vitamin D. And then whole milk is when you take that skim milk that we just talked about and you add a little bit of whole milk back to it, so that basically you titrate that to where you get a low fat milk, which is either 1% milk or 2% milk, right? Which is low fat. As you can tell, low fat milk and skim milk are processed foods, right? This is an example of a processed foods. They're taking a whole food, in this case, whole milk, and they're processing it to change it to what they think is better. And what they think is better is by making it low fat, because they're under the impression that fat is the enemy, when in fact we know now that fat is not the problem. Dietary fat does not cause fat. As a general rule, it's carbohydrates that cause fat, and it's ultimately the excess intake of calories. For the most part in this country, it's our addiction to carbohydrates. Lastly, to promote whole foods. So whole foods, of course, again, are just that. It's a whole food. It's basically the way God or nature intended food to be, right? You're not taking a whole food and extracting part of it and then adding salts and sugars and preservatives and additives and making it pretty, adding dyes and then packaging it and selling it, right? That's a processed or an ultra-processed foods. A whole food is just the original food. Examples of whole foods, fruits and vegetables, right? Just naturally occurring fruits and vegetables as they grow in the ground or on a bush or on a tree. You don't add sugar. You don't add preservatives, right? It's just the fruit or vegetable. Whole grains, brown rice, oatmeal, whole wheat bread even. They are products that are made by nature or made by God and not processed by man. Nuts and seeds in their native form, legumes such as beans, lentils, chickpeas, meats, all forms of meats, chicken, fish, red meat, turkey. You could include eggs in this. Dairy, milk, like I talked about, whole milk, yogurt, cheese. Again, I just like to tell people when I'm talking with them, when you're talking about whole foods, if God made it, or if nature made it, if you'd rather see it that way, if it's a naturally occurring product, it's probably healthy. It's when we do all of these alterations to it that we start to run into problems. So there's the origin of the food pyramid and the United States dietary guidelines, with a brief discussion about what our current Secretary of Health and Human Services is looking to do. And so the question that I pose, without an answer, is, are we on the right track? And what I would say is, currently, the guidelines that we have and the food pyramid that we had up till 2011 has not resulted in better health outcomes or even better costs for the country. And you can decide for yourself what the motive is for that. Is it to control inflation? Is it to feed the medical industrial complex? Or is it truly just to try to feed the masses? But either way, we see that the incidence of diabetes is significantly higher. The incidence of obesity is out of control, although it's leveling off around 45%. We see the incidence of heart disease, although it's somewhat different than it was in 1977. The incidence of heart disease is essentially the same. I would argue that what we've done over the past 50 years isn't working. And maybe it is like Gary Taub says, maybe we were just fed a big fat lie and we need to make some changes. So are the changes that RFK is suggesting, are they the right changes? Do you think they'll get us where we need to be? Is it not worth at least trying to make a change? Because what we're doing, we can see is not working. Those are the questions I pose to you. I'd love to hear from you. If you have any response, please hit us up on any of our social media or on our website, thebmipodcast.com. I'm your host, Dr. Drew Crawford. Join me next week as we go beyond measurements and image to build healthier lifestyles and elevate your well-being on the BMI Podcast. See you then. The BMI Podcast is provided for educational and informational purposes only and does not constitute providing medical advice or professional services. Be sure to check out our description below for our website and social media platforms.